Hi, I'm Dr. John Oldham, Chief of Staff at the Medical Clinic and on the faculty at Baylor College of Medicine. And I've been very interested in patients with personality disorders, particularly borderline personality disorder. And that's an area where I think we've learned a lot through the years. These are patients who are very disabled and very, very distressed. Many times they come into emergency rooms and clinicians are frequently struggling, doing their best to help these patients. We know a whole lot more about what helps these patients. We have a whole set of practice guidelines that are evidence-based. I chaired one group for the American Psychiatric Association here, but there are now practice guidelines from several locations in Europe and even Australia. They all say the same thing, and that is that the evidence-based recommended core primary treatment for borderline personality disorder is psychotherapy. And it can also be useful to use medications as adjunctive, symptom-targeted additional components of therapy. But to repeat that, the primary therapy needs to be psychotherapy, the treatment needs to be psychotherapy and not medications as the first type of treatment. And if medications are used, usually it should be symptom-targeted, often low dose, and usually time-limited. So that's important because patients with these conditions often go to see all kinds of therapists and are in a lot of distress. They may go to their family practice doc, they may go to the primary care doc, and they sometimes will come in with a whole set of different medications on board because, well-intendedly, these doctors are trying to help them get some relief. But when that happens, then that complicates things and actually can often lead to side effects that make things worse. Should these patients be hospitalized? That's another question I often hear. And I think we need to have hospital availability for these patients. Sometimes it's very critical and it's an acute life-saving intervention because these patients do have high suicide risk. So when they come into the hospital, even if it's just for a few days, that can decompress things and be very, very good adjunct to keeping the patients safe. Most patients need to stay in treatment over a fairly long time. More often you'll see recommendations for at least a year, but certainly long psychotherapy. And that's really critical because that length of time is what is part of the effective treatment that psychotherapy provides. Sometimes there are patients who don't get better and can't respond well to brief hospitalizations. And these are patients who may be at truly high risk for kind of sustained suicidality, or they may have just extreme difficulties functioning in the world, either socially or interpersonally, or even in terms of occupational or career functioning. And for them, sometimes a longer stay in the hospital may be very helpful. At the medical clinic where I work, we have an average length of stay of 6 to 8 weeks. And that's not always easy to find, and it's not always something that is easy to have resources to be able to afford it or have someone cover the payment for it. But we believe strongly that for a layer of patients who have conditions that often are co-occurring with things like major depression, substance use, anxiety, when these are all together, you really need time to sort things out. And you need time to work intensively, usually with a team of professionals. And with enough time, that then enables you to get to a better place. And these patients, we think, can benefit from longer-term treatment. So it's not always just brief treatment that can be helpful. For some, a longer term will be very helpful. We don't recommend a year or 2 years in the hospital. That used to be done decades ago. We know that that's in fact contraindicated, but several months would be very helpful for some if it's available. And I realize that that's a big if, but at the same time, it's important to know that that's something to strive toward if it's possible to work it out. So I hope this has been helpful, and it was a delight to be here at the conference.